Hi, I'm Dr. Shilpa. Today's topic for discussion is the positions which can make it difficult for the woman to have a normal delivery. What are the various positions of the baby? So as you can see, this is the baby. This is the baby's head, shoulders and the legs, and this is the placenta with the umbilical cord. So ideally the baby's body should be in flexed position when the baby is inside the uterus. So this is ideally how the baby is supposed to be, and this is the normal position of the baby, which is ideal for normal delivery. So sometimes what happens, this may not be possible, and see, this is the baby's head. So this position of the baby, this is what we call as the back of the head or the occiput. So ideally this should be facing upwards and this head should be down. So this is the situation where I think maximum possibility of normal delivery will be there. And sometimes what happens, the baby's this back of the head, what we call occiput, will be facing downwards and the face will be facing upwards, which may make it difficult for the baby to have a normal delivery, or the baby's head to come out normally through the vaginal outlet. See, sometimes again there could be problems where the baby may not be positioned in the ideal way with the head down position. So this is the head down position which we saw inside the uterus. Okay, so this we call it as vertex presentation, and most of the times that this is what we see, because head is the heaviest part of the body and it is the largest part of the body, and the problems during normal delivery or complications will be least when the baby is delivered in this position. So what are the problems which we can face with regard to the position? So one, I told that the occiput may not be facing like this. It could be like, the face up and the back of the head being down. So this is where the diameters, that is the diameters of the fetal head will be more, so that it will be difficult for the baby's head to negotiate the mother's pelvis and come out naturally. So the other position could be like face presentation, wherein the baby's head is completely like, extended, what we call, and the baby's face is the one which is coming out. And here it is again quite difficult for it to come out without any injuries to the baby's face, because when we do an internal examination, we kind of like, try to do the examination with our fingers and we start poking the fetal face. So this is called fetal face presentation, and sometimes it will not be completely like flexed, so it could be just showing like this. And when we put our fingers to do the examination, this is the brow. This brow will be like felt. So this is called the brow presentation. So the other positions which can cause problems during normal delivery is the breech presentation. So breech is nothing but the buttocks of the baby. So this is the breech presentation. So here the baby's buttocks will be facing down into the vaginal canal, and this may make it difficult for the baby to deliver. So in breech presentation itself, again there are various varieties where the legs can be completely like, flexed, or this can be like this we call it as complete breech, or the baby could be like this, wherein we call this as footling presentation, or one leg could be flexed, one leg could be like this. So all these are various forms of breech presentation. So in this there will be problems when the body of the baby comes out, but the head will get stuck. So this is one of the main problems in breech delivery. So the other problem is the transverse lie, wherein the baby is completely in a position horizontally inside the uterus. So this again, like, this increases the diameters of the presenting part, what we call, which is presenting. And here you can see that this is the transverse lie, and you can see that this hand can come out when the cervix dilates, and this is, we call it as hand prolapse. So it is impossible for a woman to deliver in this transverse lie, and this will 100% need to do a cesarean, and that is one of the important things that we need to note. And sometimes, like, only when the baby's head is aligned properly into the vaginal canal, when it gets fixed and engaged, then only it is possible for the baby to come out. So here sometimes the baby's head could be in oblique position, so it is not rightly aligned into the pelvic path, but it could be slightly away from it, and it could be like this or like this, which again with the contraction or even with the progressing pregnancy, it may still not possible for the baby to come out. So the last thing is the unstable lie. So unstable lie happens when there is a lot of water around the baby and there is enough space for the baby to move around. So 1 week when you come for a checkup, the baby's head will be down. 1 week when you come for a checkup, the baby's breech will be down, and sometimes it will be in oblique, sometimes it will be in transverse lie. So this is called unstable lie or changing lie, where the baby's head doesn't get fixed, and we can wait up till 37 weeks for the baby's head to be fixed, and if at all, if there is a possibility of normal delivery, to tell the patient. So this is about various positions of the baby, and ideally we check all this to counsel whether patient is going for a normal delivery or a cesarean at around say 37 to 38 weeks. And by then, because of the gravity and because the baby's head is the heaviest part, the head will 90% of the times will come down, and that will be the presenting part. I hope this is informative. I will come back with more educational videos. Thank you so much.